Tropical medicine. Bacillary dysentery. Shigellosis. Bacillary dysentery. Shigellosis. Bacillary dysentery is an acute bacterial disease involving the large and small intestine characterized by bloody mucoid diarrhea. Bacillary dysentery should not be confused with diarrhea caused by a bacterial infection. 1. Characteristic of bacillary dysentery is blood and stool, which is the result of invasion of the mucosa by the pathogen. Cause. Shigellosis is caused by one of several types of Shigella bacteria. Shigella, Shigella flexneri, Shigella dysentery. Mode of transmission. Bacillary dysentery is transmitted directly by fecal material of a patient/carrier or indirectly through contaminated food and water. Infection may occur after consuming a small number of the germs. Therefore, chance of spread among household members or in institutions can be very high. It occurs more commonly amongst young children. Clinical features. Incubation period is usually 1-3 days, but can be up to 7 days. Sudden onset of mucoid bloody diarrhea. Fever. Nausea or vomiting and abdominal crumbs. Tenuous sensation of desire to defecate without production of significant amounts of feces. Flatulence, passing gas. Headache and fatigue. Dehydration. Diagnosis. Tropical medicine. Bacillary dysentery. Shigellosis. Admission on a medical ward in isolation. Personal hygiene should be observed to avoid infecting other persons' barrier. Nursing. Disinfection of bed and other items used on the patient. Proper disinfection and disposal of fecal matter and vomit into pit latrine. Observations of TPR, BP, hydration level, ELMO, C. Reassurance of patient and relatives. Dysentery is initially managed by maintaining fluid intake using ORS or intravenous fluid if there is severe vomiting and diarrhea. Investigations. Fresh stool is collected for culture and sensitivity microscopy. Nalidixic acid 1/6 hourly for 5 days or ciprofloxacin 1g single dose. Brat diet, i.e. bananas, rice, applesauce, toast. If patient vomiting everything, a nasogastric tube is passed for feeding and drugs. Medication for nausea and vomiting, metoclopramide Placel. Monitor hydration levels and maintain a fluid balance chart. Prevention. Keep the premises and kitchen utensils clean. Dispose rubbish properly. Keep hands clean and fingernails trimmed. Wash hands properly with soap and water before eating or handling food, and after toilet or changing diapers. Drinking water should be boiled or treated. Avoid high-risk food like shellfish, raw food or semi-cooked food. Wear clean washable aprons and caps during food preparation. Clean and wash food thoroughly. Scrub and rinse fruits in clean water. Store perishable food in refrigerator well covered. Cook food thoroughly. Consume food as soon as it is done. If necessary, refrigerate cooked leftover food and consume as soon as possible. Reheat thoroughly before consumption.